back, the U.S. State Department has activated a dedicated Ebola response task force. The department says it's coordinating with U.S.-aligned companies operating in the Eastern Democratic Republic of the Congo to monitor and respond to the outbreak there. The U.S. is assisting with health screenings at borders and points of entry and has shipped emergency personnel protection equipment. The head of the World Health Organization, meanwhile, says the risk of the Ebola outbreak spreading is low globally, but the risk in the DRC and in Uganda remains high.
CBS News medical correspondent Dr. Celine Gounder joins us now. She's also editor-at-large for public health at KFF Health News. And so importantly, you were there in West Africa during the 2014 Ebola outbreak that lasted 2 years. Dr. Gounder, what do we know about the Americans who've been impacted?
So Dr. Peter Stafford, the surgeon who worked for the organization, Christian missionary organization, Serge, has been evacuated to Charité. It's a hospital in Germany that specializes in patients with special pathogens. So, for example, Ebola. His wife, Dr. Rebecca Stafford, and their 4 children have also been evacuated to Germany for quarantine and to see if they develop any symptoms of Ebola. There's a third doctor, Dr. Patrick La Rochelle, who has been evacuated to the Czech Republic. He is considered a high-risk contact like the others, the wife and the children. I do want to point out that in 2014, the Americans who had these high-risk exposures and or who had Ebola were medevaced to the United States. That did not happen this time. They were sent to Emory and the University of Nebraska Medical Center. At that time, President Trump was not president, but he had tweeted in all caps, "Keep them out of here," and had called for President Obama to resign over the fact that he was bringing them back here.
So in 2014, Americans with Ebola were brought back to the U.S., treated here in American hospitals, and in this case, they're in Europe.
Correct.
Which really just underscores the difference in policy and approach by this administration compared to previous. There's also, in this day and age, much more misinformation and disinformation at our viewers' fingertips. What have you seen that appears to be the most damaging?
Well, this is something I have seen. You know, I've worked in so many different epidemics going back to HIV/AIDS in the late 90s in South Africa, where people were saying it's a hoax. And we see the same playbook over and over and over again. So over the weekend, I used some social listening tools just to see what was starting to emerge. So
what are social listening tools? What are social listening tools?
There are different kinds of tech tools online that you can use to analyze what's coming out on different kinds of social media platforms.
Phrases and trends and themes.
Yeah, all kinds of things. And so we first heard about Ebola in the DRC on Friday. I forget if it was Sunday morning that I started looking at this. And at that point, there were over 600 videos on TikTok, YouTube, and Instagram that had already garnered over 68 million views. And they were supplement sellers.
Wow.
You had conspiracy theory accounts calling Ebola a bioweapon or a hoax. You had a tweet with photos of healthcare workers in biohazard suits. This tweet calls this a movie set, and it was actually a photo of people transporting the cruise ship passengers where there was the hantavirus outbreak. This was not a photo even of what was happening in the DRC or Uganda. So you see this same playbook over and over and over again with COVID. We saw it with Mpox, we saw it with bird flu, we've seen it with hantavirus, and now with Ebola. And a recent study showed that the 96% of the top health misinfo influencers, so spreading misinformation, have financial interest in what they're selling. Supplements, could be courses, paid memberships. And look, outbreaks make for very profitable content.
Because people are scared,
People are scared, and they leverage the fear. They leverage anger.
Be careful.
So what's your advice to people to be able to tell the truth versus what's not right?
So first, look at who is benefiting from this. Are they selling supplements? Are they asking you to follow or subscribe their account? And by the way, this is how influencers make a living, right? They build an audience. True. They sell the audience for advertising. And so this is basically marketing. It's not public health information. Secondly, look at the timing. So are they advertising a treatment just hours after the outbreak is announced. I got an email from somebody telling me baking soda was the solution to Ebola.
They emailed the wrong person.
Yeah, you're talking to the wrong person. But like, look, when you're talking about a Bundibugyo Ebola virus for which there is no approved treatment or vaccine, and then you're telling me that you have the miracle cure, that is very suspicious. And thirdly, the tone. So people who are giving reliable information are not putting things in all caps. They're not leveraging fear and anger.
Creating hype.
Exactly. They're calm.
Like you, Dr. Gounder. Thank you so much.
Thank you, Dr. Gounder. More news ahead in our next live hour. Stay right there. This is 24/7 Mornings.